Next. It will also try to improve the infant's immunity. Guys, let's talk about infant's immunity. The one recommended by American Heart Association will be 2 soft gels of collicles. Okay. Do we need to breastfeed our kids? Yes or no?
Yes.
Guys, why? Because of the so-called immunoglobulin A. Can you please say it out? Immunoglobulin A. In the first 2 days, okay, of the so-called breast milk, is the most important one. It contains colostrum. Can you please say it loud?
Colostrum.
Not colostrum. Are we clear so far, people? No, that's colostrum. And that will give you, provide your kids enough immunoglobulin A to fight microorganisms. Okay? Now, people, but there's a problem. Why? Because sometimes, okay, when a baby is born, that baby doesn't know how to suck the nipples. Yes or no? It usually happens, guys. So what we usually recommend as doctors in the hospital is for the daddy to suck the nipples. Right? Others are thinking, Doc, can we volunteer? No, only the daddy is sucking. No. Why? Because if the daddy will be able to suck the nipples, guys, it will be able to what? Stimulate the breast to produce milk. Okay? But daddies, I would like to remind you that after the breast is already already able to produce milk, you better stop. And give, of course, the rest to your kids, okay? That's good to you. Lactation, okay? Increase DHA and EPA in the mother's breast milk. Better for visual acuity at 4 months old, okay? And just look at the picture, infancy. Better muscle coordination. Guys, if I will ask you, which will develop first? The upper limbs or the lower limbs? Sagot. Upper limbs. Kamay or paa?
Kamay.
May contour. Kamay. For those who said the lower limbs, look at this. If your baby, after they're born, was able to stand up at once, tiyanak yan. Kidding aside. Of course, look at the hands. When they hold the breast, what will they be using? The hands, not the feet. Okay? That's a grouchy child, people. Of course, we would like to prevent that from happening, no? First, hold it up, okay? Dyslexia, these are problems that will confront you, okay? If and ever your child reached this age, it's dyslexia, of course, ADHD. What is that, people? When you talk about ADHD, attention deficit hyperactive disorder, that when you just leave the child, they will play. Their attention span is so short, people. And what we would like to recommend is for you to be able to bring them at once to a pediatrician that will try to guide them, people. Okay? Step by step to be able to correct this whole ADHD. Okay? That's a clinical pediatrician. Okay? What else? Another problem is dyslexia. Can you please say the word, people? Dyslexia. Okay? Learning disability. It can impair a person's fluency. The way you try to say the words, accuracy, in being able to read, not just but to read, but also to speak. Okay? And spell. In which can manifest as what? Difficulties with phonological, the words that will be coming from your mouth, people. And decoding, orthographic coding, even the simple so-called puzzles cannot be done. Okay? Auditory short-term memory and rapid naming. If you will ask them, what's your name? Robert. Okay? Regine Velasquez, when she was still young, was a dyslexic patient. And every time she memorized her songs, she usually asks someone to read it for her to be able to memorize it. But she was able to recover after. Okay? So, guys, you can already see the brain cells here. Kidding aside, people. Adulthood. Okay? What will happen here? Improvements in depression, mood disorder, anxiety, fatigue, and first confusion. And this is I would like to happen, of course, to your student and my wife. That even if you will reach the age of 80, just like Dr. Goko, he will still look young. Yeah. So can you please give the doctor a hand? Guys, what should we look as we reach the age of 80? Okay? First, enhance the so-called weight loss or decrease the belly fat. Because when we age people, remember that you're also utilizing the proteins in your muscle that will make it thinner, guys. That will cause what? Your belly to look like this. Of course, that will not be good. Okay? Second, aids in joint function, so it's a good anti-inflammatory product, people. For those suffering from arthritis. What else? Decrease the risk of stroke with 31%. And decrease sudden cardiac death by approximately 45%. That is the importance of taking omega fatty acid. What else? Wow! If your diet is like this, then most probably you will be joining this family. And what we would like to advise will be for you to have a well-balanced diet to enjoy life to the fullest. People again, wow! Half pound of beef. Are you familiar with quarter pounder, people?
Yes.
Quarter, 1/4. So this is already half pound. 4 half pounds of beef. Which means this one is equivalent to 8 quarter pounders. And to think that is only your merienda. With eggs, bacon, cheese, mayonnaise. Gosh, people. If that will only be your merienda every day, then I will assure you, pampabata. Ng buhay. Maaga kang mawawala. Okay, what else? Of course, we would like to prevent this from happening to us, stroke. It's quite easy to know if someone is suffering from stroke. So first, look at the face, unequal. Okay? Second, look at the arms. It looks like this. Doc, mayabang. If you recall them, wait. Then, if you ask them, what's your name? Are you okay? You're having a problem. Slurred speech. So please call at once the emergency service system, okay, the hospital, in order to preserve the function of the brain. Now let's talk about the brain, people. I would like to remind you guys, the different parts of the brain will be having different functions. The one in front will be responsible for your motor. The one here will be responsible for sensory, hearing, and of course, visual. Others are thinking, Doc, the eyes are here. The one responsible for the brain will be back there. Okay. For you to be able to appreciate what I'm saying, can you please form your hand like this? Can you please stop the back of your hand? What's the feeling? Para bang umalag ang mata? Yes. Because you're trying to hit a part of the brain called as the cerebellum. Okay? The one responsible for balance. They're sometimes not being protected by the skull. Now, what am I trying to drive at here? Have you ever tried to hold the brain, yes or no? Not yet? Okay. Brain of a chicken. Hindi ba yun? Fish. Okay? Sige. Later on as you go home, try to get the brain of the fish or even the chicken, then place it on your hands. And try to watch. And I will assure you, sarap agad. Why? Because the brain is as soft as a jelly. Doc, really? Yes. But it's being protected, first of course, by the hair, followed by the scalp, then of course by the skull, and the meninges, and the cerebrospinal fluid. So just try to feel your head. If you don't have a hair, so you lost one of the so-called protection. I think let's go for people, okay? So, now, if and ever accidents will happen, like what? If by chance you fell and your head hits the floor, then you might suffer from epidural hematoma. But if one of the so-called blood vessels in your brain ruptures, guys, that's subdural hematoma, or even intracerebral hematoma. And as blood accumulates inside your brain, they will try to push the substance into the brain that can damage that part of the brain. That can lead to different kinds of what manifestations or signs and symptoms. People, one more thing, that is bleeding. Okay? There is a blood clot that can go to that part of the brain. This one involves the brain stem. I'm quite sure you're still familiar with Fernando Po Jr., yes or no?
Yes.
And he died because of what? Thrombus in the brain stem. Okay? What else? That's because of what? Alcohol intake in the first cholesterol. What else? Okay? Look at these fibrin clots. Blood clots with fibrous deposits, calcium, cholesterol, people. And it just happened that it started in the blood vessels in your heart. The good news is, it was removed from the heart. But the bad news is, it traveled to the brain. So, nakaiwas ka sa atak sa puso, na-stroke ka naman. Maliwanag ba tayo? Now, people, look at this. Okay? Again, what will form these so-called clots or problems? Thrombus formation and of course, atherosclerotic plaques. Guys, if there's a clot here, will the blood still flow? Yes or no? Not anymore. And if it will happen here, that specific muscle part of the heart will die. And people, again, I would like to mention that the heart's muscle will try to follow the other non-lung. What is that? If one part of the heart will die, the entire heart will die and we will die. And again, we're dealing with cholesterol. People, these are the stages, okay, of atherosclerosis. This one will still be good, but if this will happen to you, I will assure you, you're bound to die. Okay? Now, people, again, that person is not in love. Okay? He is suffering from what? Heart attack. Guys, how can we try to reduce the incidence of stroke? First, try to reduce clumping blood platelets, reduce platelet vessel wall interaction. Second po, improve the elasticity of the endothelial linings, the one lining the blood vessels. Next, reduce the inflammatory response. Then, people, decrease the blood pressure. I would like to remind you guys that your blood pressure should be 120/80. Okay? If by chance already reaching 140, that's hypertension. Okay? And that will give more problems to your heart. What else? Decrease blood lipid and triglyceride or even the bad carriers of cholesterol from accumulating. What else? Increase and improve cerebral arterial activity. It means it will try to improve the blood flow to your brain. And finally, people, okay? Decrease blood viscosity. Okay? What else? And decrease resting heart rate. The heart's rate should be approximately 60 to 80. And the maximum should be 100. But if you are in a resting state, it should be around 60 to 70. Okay? Next. That is a person suffering from gangrene. Can you please say it loudly, people? Gangrene. Usually, it will happen for those suffering from diabetes mellitus. Guys, we had a client, okay, who suffered from gangrene of the big toe. And what happened? It was amputated. But years after, it traveled up to this part. And again, it was amputated there. I had a friend who happens to be a doctor, also a diabetic client. Her aim is gangrene, reached the knee. And he was amputated to that level. Some were clients, which the gangrene here, and they were amputated. But what if it will reach here? You're dead. Okay? So, that patient is not wearing socks, okay? So, he is suffering from gangrene, of course, of his left and right foot. Okay? And I'm afraid because this one, I guess, already reaches the level of the knee. This one's still good, but this one is no longer good. So guys, we would like to prevent those things from happening to us by trying to improve the flow of blood. People, what is the recommendation given by our medical association? That we need to take 900 milligrams, okay, of omega fatty acid, which should be, of course, 2 soft gels of Colidus every day. So the question is, people, do we need to take Colidus every day? Yes or no?
Yes!
Okay, palapakan na ako ang Colidus. Let's talk about a heart-friendly company, people. Okay? The AIM Global is a heart-friendly company, yes or no?
Yes.
So can you please look at the one beside you? Do they look friendly? I doubt. Definitely, we're a heart-friendly company. Why? We were trained to smile. Okay, why? Because every time we smile people, we're trying to what? Release a positive aura. Okay? A positive energy. And of course, according to the law of attraction, we're also going to attract positive fortune. The question is, would you like to attract positive fortune, yes or no?
Yes.
So can you please smile? And look at the one beside you, by smiling. Okay, let's start. We are talking about heart health. And people, to be honest with you, it's a major health concern worldwide. And if you're going to look at this circle, guys, it was divided into pies, different segments, different parts, wherein cardiovascular diseases that involves the heart and the blood vessels comprises 30% of the total diseases, okay, that we can suffer from. Now, what's alarming is, many deaths can occur prematurely under the age of 70, and most of us are under the age of 70. And one more thing that needs to be mentioned, 80% of premature heart disease, stroke and diabetes can be prevented. That's the good news. Let's talk about this one. Okay? Disorders of the heart and the blood vessels. That is the heart again. That is the blood vessel with a thrombus and with atherosclerotic plaques. Okay? Look at this. Look at the one. Okay? Below. 50% of individuals who die suddenly of coronary heart diseases. Coronary artery is the blood vessel that will supply blood to the muscles of the heart. Okay? Have no previous symptoms of the disease. It's also called asymptomatic. You're not feeling anything. You think you're healthy. Okay? Because there are no signs and symptoms. But 95% of people who have sudden cardiac arrest die from it at once, within few minutes. I've trained in MCU. It's a family med resident that became, of course, a consultant later on. And I was able to see, okay, I saw different clients who died suddenly of a known causes. That is sudden cardiac death. And the youngest client that I was able to see, that I saw in the hospital, in the emergency room, was only 18 years old. Thinner than you. How young for that? 21. My client was 18. 21. Pwede na. Pwede na mag-start ng exercise, na mag-reduce. Okay? Okay, keep on.